Thank you, Chairwoman Luria. Ms. Murphy, this question is for you. In the report, there was concern about the coordination between VAH and VBA, and in further coordinating, and how do you plan to further coordinate to provide support for veterans going through the MST claims process?
I think it's an important topic. I'm going to ask my colleague, Ms. Rawls. Her office is heavily involved in working with the VBA outreach coordinators and with our outreach efforts in this part of the department.
Thank you very much for the question. We currently are training quarterly our MST outreach coordinators at every regional office. As Ms. Murphy has mentioned, we've also implemented our outreach training symposiums that will include all of the coordinators and processors, making the distinction between the coordinators being at every regional office and the processors being consolidated to the 5 regional offices and eventually to the 1. And when we're going through that, we are continuing to reach out to VHA and include them in those training symposiums. Now, at the regional level, they are working across and coordinating with each outreach coordinator for every medical center within their catchment area. And so you have these integrated pieces at the local level for the regional offices and medical centers, as well as the national level. So we're continuing to strengthen those and ensure that those individuals are identified and that they have clear instructions and guidance on how to reach out and when to reach out. Thank you.
Thank you. And Dr. McGuire, would you like to comment?
Yes, I would agree with what Ms. Rawls has just stated. We do have an awareness both at the local and at the national level of the importance of integrating services. Most importantly, of course, in the individual case for each veteran seeking either a claim for MST or for medical services related to MST. So I concur with what she said. It's an active area where we want to improve. We know that there is an opportunity for service recovery when things don't go correctly. So the relationship at the field in real time between the MST coordinator on the VHA side and the MST outreach coordinators on the VBA side is critical and of mutual concern to both of us.
Thank you. And Ms. Murphy, can you explain the timeline for the VA to update its decision notices to ensure that they are more sensitive to the experiences of MST survivors? And will you engage stakeholders in the revised language?
I think this is ongoing work. This is also particularly a recommendation and an action item from what was mentioned earlier, the Secretary's work group to engage with VHA and our Veterans Experience Office from human-centered design standpoint to look at those communications and see whether there could be improvements to make them to really reach out in a more compassionate way to our MST survivors.
And do you plan to engage stakeholders?
We can add that to our list if it wasn't already on there. Yes, ma'am.
Thank you so much. Chairwoman Luria, I yield back my time and thank you to our panelists.